Fading photographs. Peter Marshall, BBC North West Tonight, Hyde.
Poignant research.
Now, it has been revealed tonight that some patients have been waiting more than 20 hours for a hospital bed at Stepping Hill in Stockport. The hospital says there's immense strain on services and, as a result, huge stress on the staff.
Well, the reason the hospital says is because all of the beds are full. Let's talk to our health correspondent, Jill Dummigan. She's been looking into the story this afternoon. She's here now. Tell us a bit more, Jill.
All this winter, Stepping Hill Hospital has been struggling to cope with the sheer number of people going there. It's fairly regularly been more than 97% full. Now, national guidelines say it should be 85%. The end result can be patients stuck in corridors for long periods waiting to find a hospital bed. Now, to try to cope with this, a new umbrella body called Stockport Together has been formed, but it's running into a few teething problems. At Grandad's Fish and Chip Shop, the senior citizens' lunchtime special's doing a roaring trade.
It's a gathering place. They like to come and meet, have some meals together and go and do some shopping around Stockport.
And business is only going to get better. Over the next 5 years in Stockport, the number of people aged over 65 is predicted to rise by more than 2,500. And that means the healthcare system needs to adapt to look after them. Stockport's one of 6 areas in the northwest which has been chosen to pioneer new ways of keeping older people out of hospital, because at the moment there are too many of them stuck in there when they could be better looked after somewhere else. That's not good for them and it's expensive. To tackle that, the people here want to improve community health and social care provision and get the whole system working better together. The people behind the project say it's already showing benefits, but it's started to run into some problems. Many of the staff involved, social workers, physiotherapists, are about to vote on a strike over proposals to extend working hours and change their role.
They're upset that, social workers will be spread more thinly and they won't be as available for their users. That some of the qualified roles will be taking on managerial duties, which again takes them away from that work which they were trained for and which they entered their professions for.
And then there's a proposal which appears to consider bed closures at Stepping Hill. The public consultation showed only 40% in favour. Campaigners are now organising weekly protests outside.
All of us here in this group totally support integration of health and social care, but it does not reduce the demand for hospital care. All the studies, nationally and internationally, have shown at best that it reduces the rate of rise of the demand.
Stockport Together's master plan assumed that improvements to community health and social care would mean a drop in demand for A&E of nearly 26% over the following 5 years. 18% of that would be in the first 12 months. But that document was written 12 months ago. And if you look at what actually happened, demand for the main A&E here actually rose by nearly 3%, while the number of emergency admissions went up by more than 5%. One health think tank says Stockport's only one of a number of pilot areas making over-ambitious assumptions on how much they can reduce the need for hospital beds.
I'm afraid there are quite a lot of examples where the type of numbers that have been put into those plans are probably not credible in the time that is being allowed for the changes to take place.
No one involved in Stockport Together was able to be interviewed, and we couldn't film any of their work. They did tell us that many of the changes had already begun to make a real difference, but admitted they hadn't achieved the scale of changes they wanted in this first year.
Jill, Stepping Hill's not unique here, is it? Lots of hospitals have been struggling this winter.
They really have, and particularly the Royal Bolton and Macclesfield General. It's not unusual that they've been completely full this winter, 100% occupancy. Blackpool Victoria's had real problems with patients being stuck in corridors for 12 hours or more waiting to find a bed. Now, hopefully projects like Stockport Together will finally make a difference, but it looks like it could be a while yet.
Yeah, lots of NHS staff working hard, we know that. Jill, thanks very much indeed. Now, when Kira Byland was 12...